Welcome back, friends. In this module, I am going to talk about types of anesthesia. This is actually a very interesting topic. In this module, I am going to tell about all the different forms of anesthesia which can be administered to the patients. And I am going to talk in detail about each and every one. So by the end of this module, you will get the knowledge what actually anesthesia is, how it is administered, and for which all surgeries, which forms of anesthesia could be administered safely so that patient has painless surgery. Now coming back to types of anesthesia, anesthesia could be divided into two types, that is regional and general. But regional anesthesia per se can be given in different forms. Regional anesthesia could be divided into topical anesthesia or topical analgesia, that is surface anesthesia. This form of anesthesia can be achieved by not by injecting drug or anything, but applying the drug to the surface. This form of anesthesia is called topical analgesia. Second form is infiltration analgesia. In this form, drug is injected inside in the subcutaneous tissue with the help of a needle, and that part of body could be anesthetized. Third form is nerve block. This can be achieved by blocking a nerve by injecting local anesthetic solution through the pathway of the nerve so that all the regions supplied by that particular nerve is anesthetized. And fourth is conduction block. In this, block is achieved by blocking all the nerves supplying a specific region of the body. The second type of anesthesia is IV regional anesthesia or Bayer's block. This is very interesting form of anesthesia because normally local anesthetic solutions, they cannot be given intravenously. But in this form of block, you inject the drug, local anesthetic drug, intravenously and achieve block of a whole arm. And this type of anesthesia is called intravenous regional anesthesia. Then there is also called other form of anesthesia, that is spinal anesthesia, in which drug is injected into subarachnoid space. Then there is epidural anesthesia, in which local anesthetic solution is injected outside the dura. I'm going to talk in detail about how this particular anesthesia is achieved. And then the last but not the least is general anesthesia. Now coming back, as you can see on the screen, I'm just going to tell you how and what are the different forms of anesthesia, which I had already discussed before. Cryoanesthesia, that is insensibility resulting from the cold. Local anesthesia, or this is also called as we can also discuss it as infiltration anesthesia or other form of anesthesia, that is loss of sensation in small area of a body. Block anesthesia, in which anesthesia is achieved by blocking the nerve to an area supplied by a body. That is anesthesia achieved to a part of body which is supplied by a specific nerve. Then there is regional anesthesia, where is loss of sensation to all the nerves supplying a region of body. General anesthesia, that is state of total unconsciousness, which includes analgesia, amnesia, and total loss of consciousness. Now coming back to regional anesthesia, I will discuss each and every anesthesia in detail. First is topical analgesia or surface analgesia. As I said before, this is achieved without injecting any local anesthetic solution inside the body. Then how it is achieved? It could be achieved by various ways. Say for example, first by applying analgesic or anesthetic solution on gauze piece, or which was used previously to just make patient or any of your colleague unconscious, or any of your enemy or friend unconscious by applying chloroform solution on gauze piece and putting that particular solution on the nose. Patient or that particular person becomes unconscious. This form of analgesia is called topical analgesia. This is achieved by using anesthetic solution on gauze piece, for example chloroform. The other form of topical analgesia is easily available in market. This is called as liquid sprays, which are available in market for local sprays for any pain. Say for example muscle spray in muscle pain. The liquid sprays which are available in market, you just apply that spray on the body. They act as counter-irritant mechanism and then achieve the analgesia in that particular part of body by this counter-irritant mechanism, and that particular part of body is anesthetized. So for example, if you apply any local spray available in the market on the body for your local pain of shoulder or back. But that part of that pain is relieved instantaneously as soon as you apply that particular spray to that particular part of body. But the actual mechanism of this is that spray acts as a counter irritant mechanism. Your focus is shifted to the spray, and that's why you just forget about the actual pain that you have because of that particular muscle or spray. So this form of anesthesia is called topical analgesia, which can be used as liquid spray. Some of liquid pain or liquid creams or ointment are available. For example, Imla cream. This also achieves the same. This also serves the same purpose. There are also available aerosols in the market, which also serves the same purpose. Also, direct instillation. Some of the eye drops are available. For example, in conjunctival sac for some ophthalmic surgeries, these eye drops can be used directly can be applied directly on the cornea, and that part of body could be anesthetized. So these are the various forms of analgesia, or you can describe it as topical analgesia or surface analgesia, which are available in market and readily used in. Then the second form of anesthesia is infiltration analgesia. This form of analgesia is achieved by raising a wheel in the body with a fine needle, and then a large needle is used to inject bulk of the solution in the circumferential direction. Remember, the direction in which the local anesthetic solution is injected is circumferential. This is done so that all the area, surrounding area covering that particular part of body which is supposed to be anesthetized is covered, and surface analgesia is achieved through to all the part of body. So how do you do it? A wheel is raised with the help of fine needle. Through the wheel, a large needle is used to inject bulk of the solution in circumferential manner. Infiltration should be intradermal and subcutaneous. Remember, while injecting the drug, it should only be intradermal and subcutaneous. You should not inject the needle or the large needle which you are using below the dermis of the skin, because if you do that, then you will not be able to achieve the analgesia. For example, local infiltration in minor surgeries, and the solution used for this particular type of analgesia is 0.5 to 1% solution of lignocaine or procaine. Then the next form of analgesia is intravenous regional analgesia. This was described by Bayer in the year 1908. It is also called as Bayer's block. This consists of injecting local anesthetic solution into the vein of a limb, preferably upper limb, that has been made ischemic by a tourniquet. This is useful in upper arm surgeries. It also could be used in lower limb surgeries. I am going to talk in detail about this particular form of anesthesia. Then regional anesthesia, the other form is nerve block. That is, a specific nerve is blocked at a specific site to produce analgesia to the parts supplied by that nerve. For example, wrist block, facial nerve block, trigeminal nerve block, and others. The other form of regional anesthesia is conduction block. This type of block blocks the whole plexus of nerves. Whole area supplied by the plexus is anesthetized. It is most important in upper limb surgeries. Drugs used is 1 to 2% of xylocaine solution, or 0.25 to 5.5% of bupivacaine solution, or combination of both in various proportions and in various volumes. Example of this particular block is brachial plexus block and cervical plexus block. I am going to talk in detail about brachial plexus block and all the various approaches of this particular block in the coming module. Then spinal anesthesia. It involves injecting local anesthetic solutions in the subarachnoid space with the help of a spinal needle. Spinal needle, as I have already discussed with you in the equipments lecture, I have already talked about spinal needle, various forms of spinal needle, types of spinal needle. Drugs used for producing spinal anesthesia is 0.5% bupivacaine heavy or 0.5% xylocaine heavy. This is used to achieve block. Now you will always there's a doubt that will come to your mind that why this heavy word is used in this particular, because this heavy word has never been used in any of the local anesthetic solutions before or throughout the module. The word heavy indicates that in this particular drugs contain 5% dextrose. This is used so that the drug becomes hyperbaric as compared to CSF. And when you are injecting this particular drug in the CSF, the drug settles down. That's why the level of block is achieved and you can control the level of block. That's why this heavy solution is used. What are the advantages of spinal anesthesia? It is a safe alternative to general anesthesia. It can be rapidly used in obstetric and lower limb surgeries. Then other form of regional anesthesia is epidural anesthesia. It includes blockage of nerve roots outside the dura mater. A method, how do you define it? A method giving reflex flaccidity to the muscles, analgesia, hypotension and ischemia, consequent to sympathetic blockade with continuous spontaneous respiration. This is the definition of epidural anesthesia. In simple terms, what it means is you inject the drug outside the dura mater, and when this local anesthetic solution is injected outside the dura mater, it causes reflex flaccidity to the muscles. It achieves analgesia to that particular level of the body, plus ischemia and hypotension. This is achieved because of sympathetic blockade that is caused due to injection of this particular drug. Now, how and where is it used? It is used in relief of pain or pain management and or various surgical procedures. It can also be used in labor analgesia. It can also be used to supplement general anesthesia. Now, general anesthesia, as I already said, it is analgesia plus amnesia plus unconsciousness. What are the various types of general anesthesia? First is TIVA or total intravenous anesthesia. This type of general anesthesia is achieved by using only intravenous drugs. No other form of analgesic solution or drug is used to achieve this form of anesthesia. This is very useful in short procedures as the recovery time is very quick and patient can be awakened as soon as the procedure is over. The second form of general anesthesia is GA with spontaneous respiration. This form of anesthesia is achieved by injecting drugs in various proportions and various forms of drugs, but only thing, patient is breathing spontaneously. Therefore, you do not have any control on his respiration. Patient is doing spontaneously. This form of anesthesia is given in short procedures and Mapleson A circuit is used in this particular form of anesthesia. This is used for small procedures, let's say small upper limb surgeries, lower limb surgeries. It's procedures which get over by 10 to 15 minutes and patient can be awakened as quickly as possible. Then the next form of GA is general anesthesia with controlled respiration. This is total general anesthesia in which the whole body of patient is under your control. You are controlling his respiration, you are controlling his pain, you are controlling his amnesia, and you are totally responsible for his life till the surgery is over. So this is complete general anesthesia in which there is controlled respiration and respiration is in the hand of anesthetist. Now talking about TIVA or total intravenous anesthesia. This is achievement of general anesthesia with only intravenous agents. Features, these are useful in small surgical procedures. The most important aspect of this form of anesthesia is spontaneous respiration is present. That is, patient is able to breathe on his own. This can be used with the help of LAMA or laryngeal mask airway. This is a small equipment which is used to maintain TIVA. That is, if a patient is being given total intravenous anesthesia, his respiration has to be controlled. But there are chances that the tongue might block and tongue fall may occur, and then there will be restriction in the respiration of the patient. To counter this particular thing, this instrument, that is LAMA, is used, laryngeal mask airway. Now TIVA can be used for daycare procedures or ambulatory surgeries. The advantages are there is no residual effects of combination of agents and quick recovery. Now the next form of anesthesia is general anesthesia with controlled respiration. This is useful for long duration of surgeries. How do you define it? It is very simple. Combination of sedatives, hypnotics, antiemetics, volatile anesthetics, analgesic, inducing agents and muscle relaxant, which are used in various proportions as per the patient's age, need, weight, stature, surgical procedure, duration of surgery and systemic status of patient. So isn't it a small and simple definition? I know it's very difficult, but the To understand it very simply, general anesthesia is you use various drugs which are available, which may be inhalational agents, sedatives, induction agents, maintenance agents in various proportions, and each patient is different from other. Each patient's need is different. The surgery for which patient is being admitted is different. So it is the anesthetist's point of view for each patient how much drug and in what proportion he has to administer, so that the main aim of surgery or anesthesia, that is painless analgesia, is achieved, amnesia is achieved, and there is total loss of consciousness. So this can be achieved by combination of various agents: sedatives, hypnotics, antiemetics, volatile agents, induction agents, maintenance agents in various proportions, so that this particular aim of general anesthesia, that is analgesia, amnesia, and loss of consciousness, is achieved. This is GA with controlled restriction. Now, just as I said before, I am going to talk one form of conduction block, that is brachial plexus block, in detail. I am going to talk in detail which nerves routes it supplies, how do you block, what are the various approaches, what are the drugs used to block this particular plexus. It will be a long session. Please try and understand and concentrate. Now, brachial plexus block. Brachial plexus, as you all know, being MBBS students, it supplies from C5 to T1. This is formed by anterior primary divisions of C5, C6, C7, C8 and T1. These are nerve roots which join together and supply mostly the upper limb. Now, how do you perform this particular block? It is performed by injecting local anesthetic solution along the nerves that thus causing conduction block, resulting in loss of sensation, motor and sensory supply of upper limb. It can be achieved by 4 techniques, that is supraclavicular approach, interscalene approach, subclavian approach and axillary approach. These are 4 approaches by which this brachial plexus block could be achieved, that is supraclavicular approach, interscalene approach, subclavian approach and axillary approach. I am going to talk in detail about each of them. Now first, let's go to supraclavicular approach. How do you give it? Site. First, whenever you give a block to a patient, you should always know at what site you are going to block that particular nerve or plexus. Now, site in supraclavicular approach, patient is in sitting or supine position. Head is rotated to other side. If suppose you are going to block right limb of the patient, head should be rotated to the other side. A wheel is raised midpoint between sternocleidomastoid and acromioclavicular joint. A small wheel is raised in this supraclavicular approach, but after a patient is in supine position or sitting position, head rotated to one side, a small wheel is raised in the midpoint between sternoclavicular and acromioclavicular joint. This line which is crossing down from this particular place, coming down from EJV, that is external jugular vein. Then palpate the subclavian artery in this particular group, and lateral to this subclavian artery or lateral to the outer border of scalenus anterior muscle. So this is the site actually where you are going to inject the drug and achieve this brachial plexus block. Now I want each one of you to just go through whatever I have discussed over here on your own body, so that you feel actually where you are going to inject this particular drug. So again I repeat, first, patient is in sitting or supine position, head is rotated to the other side, a small wheel is raised to midpoint joining sternoclavicular and acromioclavicular joint, crossing the line coming from EJV, that is external jugular vein, lateral to the pulsating subclavian artery and lateral to the outer border of scalenus anterior muscle. Procedure, again I will talk. The procedure is, needle is inserted, then once the wheel is raised at the site which I just said before, needle is inserted through the wheel, and the direction of needle is very important. It should be downwards, backwards and inwards. Say for example, if you are talking about blocking the right limb, the direction of the needle through which you are going to inject local anesthetic solution should be downwards, backwards and inwards. This should be the direction if you are going to block by supraclavicular approach, such that it is pointing towards the spine of T2 and T4 vertebra. In this direction, the point of the needle by which it is you are going to inject the drug, the tip should point to the spine of T4 and T2 and T4 vertebra. Finger should guide the needle medially. If paresthesia is failed, as you enter the skin, as you enter the vein, a paresthesia is failed in the upper limb. Paresthesia is like tingling and numbness sensation, tingling sensation present throughout the upper limb. If at all this particular sensation is failed, the needle is steadied and 30 ml of local anesthetic solution is injected at that particular site. As and when you inject the local anesthetic solution at that site, the whole of upper limb is analgesized or anesthetized. If paresthesia, now there are two situations. First is just as I said, if paresthesia is failed. But the second situation, if paresthesia is not failed, if at all, by during that procedure, if paresthesia is not failed, then upper surface and as you go deep inside in the direction, just as I said before, that is downward, backwards and inward, you hit the first rib and first rib is contracted. Then needle is inserted on the rib. You start walking on the rib. You start moving the needle on the rib. At a particular point, paresthesia will be felt on the upper limb. And whenever that paresthesia is felt, that is tingling and numbness sensation is felt in the upper limb, you inject the 30 ml solution at that particular site and upper limb is anesthetized completely by supraclavicular approach. Then what are the nerves blocked by this particular approach? First is median nerve, musculocutaneous nerve, radial nerve, axillary nerve, ulnar nerve, and median cutaneous nerve of arm and forearm. Thus, most of the nerves supplying upper limb, both sensory and motor, are supplied by this particular block in supraclavicular approach. Dose, how much dose should be injected? Approximately 30 to 40 ml of xylocaine solution with adrenaline, or mixed solution if you are using say 0.25 to 0.5% of bupivacaine with 1 to 2% of xylocaine diluted to around 40 to 50 ml. What are the complications of this type of block or this type of approach? First and foremost is phrenic nerve paralysis. And as you know, if phrenic nerve is paralyzed due to the injection, or if due to the technical fallacies, if phrenic nerve is paralyzed, diaphragm is paralyzed and patient goes in respiratory arrest. Pneumothorax, this can also occur accidentally if the direction of the needle through which you are injecting the drug is not proper, or there is some technical flaws during injecting the drug. Accidental pleural puncture and puncture of any of the surrounding vessels, because you are approaching from the neck and neck is surrounded by major vessels, external jugular vein, carotids, internal jugular vein. Accidentally, if you rupture any of this vein, this can be catastrophic. So this is the first approach by which you are going to by which you can achieve brachial plexus block. This is the supraclavicular approach. Now next, in detail, I'll talk about the second form, that is interscannel or cervical approach, in the next session. Thank you.